Good afternoon and welcome to Webinar Wednesday. We're excited to have over 200 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday t-shirt for answering this trivia question. May is National Hamburger Month. What is the most popular topping for hamburgers? Answer now using the questions feature on your dashboard. While you're answering, I just want to remind everyone that if you've missed any of our previous webinars, you can watch them on our website, webinarwednesday.live, and you can still receive a CE credit as well. Also, next week is HTM week, and TechNation wants to celebrate it with all of you. Just share a photo of yourself or your department reading TechNation magazine or performing an HTM task. One lucky winner will be selected at random on Friday, May the 22nd, and announced via social media. The winner and their department will win a pizza party and HTM t-shirts valued at $250. Visit onetechnation.com/HTM- week-contest for more information. Okay, let's see who the winner of our Webinar Wednesday t-shirt is. And it is Wayne Paulson. Congratulations, Wayne. Of course, the correct answer is cheese, but closely followed by onions. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo helps companies better manage enterprise assets using modern, mobile, real-time reporting and an industry-leading cloud-based platform. Visit nuvolo.com for more information. Our presenters today are Dustin Smith, Senior Solutions Consultant at Nuvolo, and Dave Brennan, SVP Chief Product Officer at PartSource. Dustin, you may begin whenever you're ready.
Thank you. So today, as you can see on your screen, we're going to be talking about managing parts inventory during recovery. And it's going to be presented with me and Dave Brennan. Really quickly, we'll go through some introductions just to add some validity to who we are. I'm Dustin Smith, a Senior Solution Consultant with Nuvolo. I was, prior to being with Nuvolo, I was with Intermountain Healthcare for over 13 years. I spent a lot of time focusing on business processes and data integrity, and really doing what I could to not only enable leadership, but also enable engineers and try and make their lives easier. Dave, you want to share some about yourself?
Sure, thanks, Dustin. So as the Chief Product Officer for PartSource, I look after our new product development as well as our supply chain activities. And prior to that, I spent a lifetime at GE Healthcare working on designing HTM and clinical engineering solutions for teams all over the world. And in that capacity, I ran various portions of our service business, but most recently focused quite a bit on parts and e-commerce strategies, which is a good segue into the PartSource service platform, which we'll talk about in a minute.
All right, so today, what we're planning on going over, we just went over our introductions. Next, we'll be going through some of the challenges in a COVID world and also challenges associated with clinical part sourcing. After that, we're going to look at what Nuvolo and PartSource have done together and their integration and what that looks like. We'll discuss the benefits from that integration. We'll then go into a demo of how it all works. And then we'll talk about Nuvolo's approach to a fully connected workplace. And lastly, we'll finish on any questions and answers.
Thanks, Dustin. So I'll kick things off with just a couple slides here about what we're all going through and tie that into the Nuvolo partnership that we have. And before I do that, I would just say to all the HTM community, clinical engineering community out there on the line, thank you, thank you, thank you. This pandemic has been crazy for all of us. It's touched all of us, our families, our businesses, our communities, and our hearts go out to those that have been impacted either directly or indirectly. And I know that you folks are on the front line, and we couldn't frankly be any prouder of you and pleased and committed to serving you every day. As many of you know, PartSource is a technology-based service company that services over 3,500 hospitals in the US, and as a partner, in many ways, an extension of the HTM team. Our role is to bring the best of the best products and services to you, the HTM community. And we built a platform that brings together thousands and thousands of suppliers with thousands of hospitals and delivering savings and efficiency, but that gives us sort of a unique perspective on what everyone's going through. And so we spend all day and all night working with hospitals across the US as they've been going through the COVID-19 crisis. So I'm just going to walk you through the top of the page, which is really sort of the three phases of COVID-19 that I've observed, and then some of the conversations that we've been having during each stage along the bottom. So in the upper left, I'll just talk a little bit about the early days. The early days were all about what we call resolve, where we as a community, we as a country, we as an HTM unit were resolved not to be beaten by this virus, resolved to find solutions, resolved to help each other in classic clinical engineering fashion. There's a lot of creativity that we saw, a lot of great questions, a lot of peer-to-peer assistance, and also a lot of sort of panic and unknown where people didn't have the right data and didn't have the right preparations in place. By about mid-April, we started to see people moving out of this phase into what we call this resilience phase. And I say resilience in the sense that it's all about making things work, making it work where there's less certainty than ever. We've got low patient counts. We've got no elective procedures going on at that point, with no revenue flowing. We were seeing extensive layoffs, furloughed employees, certainly different staffing solutions and HCM teams around the US, and many of whom had been impacted themselves by the virus, so they weren't at full fighting strength. And they were all asking the same question, which is, how do we reopen? What do we do to prepare? What's next, right? And we'll talk about that in a second. And then many in recent days, literally, have turned the corner into what we call this return phase. And now they're asking about either they're just opened or they're on the brink of opening, and they're really dealing with the question of how do we scale up and how do we prepare, right? So across the bottom, as I said, these are the key conversations we've been having. We don't have time. There's probably 3 hours of content here to talk about all of them. But I know we've got time for questions at the end of this dialogue. So please craft some questions along the way. But what I've observed is that top tier HTM programs are really taking a proactive stance. They are seeking out partnerships with those in their supply chain who are pursuing what we call active supplier management, right? The constant monitoring of supply and demand signals across many, many modalities, across many, many parts categories, and looking for help. And sometimes that's peer-to-peer, sometimes that's calling us. I would say for our part, we've spent the last few weeks and months distributing thousands of copies of our COVID-19 modality and parts guides, which are all about what are the suggested quantities and the suggested parts one should be considering for key models in the clinical pathways for treating COVID-19. In recent weeks, we've been shifting our focus to imaging and surgery and other key modalities that are certainly poised for a comeback. But it goes beyond that. People want to know, how do I set up surveillance systems? What quality factors should I be looking at? And I think that really shines a light on our business model, and we're proud to serve in that way, curating the parts that you need and making sure that you're getting the highest quality parts at the most reliable, from the most reliable vendors at the right price. But it's not about us, it's about how people are responding to this situation. And we've been encouraging everyone to do their homework, dig into their data sets, if they don't have them, pull in trusted vendors, pull in peers, look at their work order data, look at their consumption data, and seek out partners who can help them really understand how to build contingency plans and what parts to be thinking about, what parts are on back order. The best in the industry are going to be able to tell you SKU by SKU, model by model, and they're going to be able to help you configure custom contingency plans as you go through either those that we know are still fighting the disease actively, or those that are ramping down, and those that are also sort of ramping up. What we're seeing is that the sort of top thinkers in the industry are not protective of their data. They're actually sharing their data. They're actively sharing it. They're sending it to us in Excel spreadsheets every day saying, you know, help me find cost out solutions. Are there other ways I can reduce my spend? Are there alternatives to what I'm currently doing? Here's my staffing model. And I recognize that that can be really difficult, especially if you're in this resilience phase already and you don't have data. So I encourage you to reach out to us or really within your peer network for their conclusions. And they're out there. There are ways that you can approach the procurement challenge in a much more data-rich, data-driven way. We're going to talk a little bit about that in a minute. But there's almost always more you can do with data and with sharing it, so you can find holistic solutions for you and your team. Which brings me to the lower right portion of the screen here. The leadership that we're talking to across the US, the leading HTM programs, know that they need scalable solutions right now. They know that they're constrained by resources. There will be more backlogs as the systems reopen across the US. They are open about acknowledging that they're likely already behind the curve, whether that's from a parts visibility perspective, from a staffing perspective, from an understanding the procedural or diagnostic mix of activities that will occur in their hospitals when those hospitals reopen. They definitely understand that their funding has been reduced or completely removed. And so that is creating a bit of a moving target. And the best of them are being very thoughtful and honest about assessing their capacity. We see them triaging what they should be doing in-house versus what might be outsourced cost effectively, and adopting a different mindset, a mindset that is really dominated by not can I do this particular task within my imaging fleet or my biomedical fleet, but really should I be doing this task? For our part, most people don't realize that we curate over 500 field service engineers, and those that do have been calling us, scheduling PMs for the next 6 to 8 weeks as they look for easy and cost-effective ways to scale their internal teams. And that's sort of the point. Most people are doing it in an ad hoc way. Others are taking a leadership position and sort of allocating entire modalities to outsourcing so that they can really retain their skilled employees for the most critical needs. And I think that's the advice that I've been giving out to HTM leaders across the country, which is, decide what you're best at, decide where your skills are best utilized, where can you proactively control downtime, what steps can you take to extend the life of your critical assets. Another example I always give is our sort of depot repair offering. We repair thousands and thousands of small portable pieces of equipment every week. And what's interesting is that a sizable chunk of that business comes from systems that actually can repair those devices themselves, but they have chosen to control their own destiny. They've chosen to use their scarce resources elsewhere. And so the point is that proactive capacity planning, proactive data analysis is what allows you to choose your battles, and that data is critical. So we're going to talk a little bit about that today. If you don't have historical data, then you need to find someone to partner with, as I mentioned earlier. PartSource in particular, given our curated supply base, we get asked routinely to guide people through what we consider to be sort of our precision procurement process. So if you want to go to the next slide, Dustin, we'll talk a little bit about those challenges in today's market, and why we do what we do, and why we partner with folks like Nuvolo. So I think the best way to start it is to say that, you know, far too many hospitals in the United States are trapped in relatively archaic processes, and not of their own choosing. The economics of the matter just force this upon the hospital system. They often lack accurate information. They certainly lack actionable data. And if you think about it, the task is a very daunting one. To manage parts within this environment means you need to track prices on tens of thousands, hundreds of thousands, in some cases, many more than that, SKUs year after year. And most folks aren't equipped to surveil the market holistically. They're not equipped to look at all the market options and alternatives. They're not certainly equipped to then aggregate that data across thousands of vendors and then present that to their teams in very simple, easy to use procurement workflows. It's actually very disparate kinds of workflows that most people are forced to endure. You know, at PartSource, we talk a lot about curating data, maybe every day, 100 times a day. And during the COVID crisis, this has become absolutely critical for the whole industry, to look at that data set, make sure we can understand it, make sure everybody understands what is too much to put on the shelf, and how to use your critical and funds in the most intelligent and adequate manner. The second point I'd make on this slide is really about knowledge management, and hospitals typically lack the processes and tools to manage knowledge across disparate teams, multiple locations, multiple IT systems. So even if they have done the research that I just talked about, even if they do have opinions on what is the right SKU, they have surveilled the market, as I talked about, actually putting that into practice is very, very challenging. If you think about it, the sort of foundation of medical practice and healthcare is grounded in shared trials. It's grounded in learning and documenting solutions that eventually become formulaic. We all use terms like procedures or prescriptions or protocols, and yet this sort of scientific approach hasn't really been practiced within the HTM space. It's limited to the clinical space. So we at PartSource are, actively try to attack that and apply science to it. We've talked about curating the millions of SKUs that are in our catalog. What's more interesting, I think, is that we then allow hospital systems to apply preferences to them, right? So we can then serve up through our proprietary algorithms the best price, quality, efficiency options for a particular problem, for a particular SKU, to an HTM leader, and then they can code effectively, hard code their decisions into the procurement process so that everyone across a system, like an HCA or a Kaiser or a Mayo Clinic, can see that particular SKU and be prescribed that particular SKU by their leadership when that's appropriate. And that's what we call precision procurement. Then the third point here is the abundance of analog processes. Outdated supply chains, underfunded for decades, are still holding much of the industry back. And again, it's not their fault. They've been funded that way. They have poor access to root cause quality data. They're often, their systems don't allow them to track IDs very well. There are poor order management practices across the space. And I think this COVID-19 crisis has sort of sadly exposed this to the world, and those weaknesses have, in a sort of a cryptic way, put a spotlight on our business model. With our vast sets of data and our thousands of vendor relationships and our algorithms and our technology, we wake up every day and we're not just trying to deliver great e-commerce. It's really about that precision procurement process that I just talked about and guaranteeing success of your enterprise through whether that's through quality or savings or efficiency. So that said, today we're here as partners with Nuvolo to discuss how our platforms can be used in tandem to do just that, to further your goals, to improve your data, ultimately give you more control over your assets on a daily basis. So thanks for the time. Dustin, I'll turn it over to you.
Awesome. Thanks, Dave. I really appreciate the introduction to kind of where we're at today, what some of the impact of COVID has been. Two key takeaways that I'm going to try and talk to throughout the remainder of this presentation. Didn't have the right data. That was one of the things that was brought up multiple times. And then also the desire to be proactive and look for assistance from other areas. And when we're talking about looking for assistance, one of the ways that we can get that is through tools. Ultimately, your tools, they're a foundational resource that should enable the business. And that's why Nuvolo and PartSource have partnered together to create this integration, is we want to make things easy for the engineer. And when we talk about the improved user experience, that's with the engineer's workflow in mind. And then along those lines, the focus on data. Let's use a key that can be passed between different systems so that there's not human error. And that's going to enable other areas of the business in the future. A good example of that is reporting. We're also going to want to utilize business workflows and have those in our system to enable process automation. Again, make it as easy as possible. Let the engineer make the parts request, and then the systems handle the rest of it. Handle that flow to the ERP. Bring the information back from PartSource to the CMMS. And lastly, we want to simplify order tracking. Have a single source that you can defer to understand where your parts are at. With these in mind, this is essentially what we came off with. While in Nuvolo, you're going to start by looking at a work order. And from there, you would actually punch out to the PartSource parts finder user interface that the vast majority of engineers are already familiar with. It's an environment that they already understand. They know how to navigate. You'll go through the process of picking your parts and checking out the same way you always have. And then that information is actually going to be transmitted back. And if you have an integration from Nuvolo to your ERP, it's going to go through all of that process. And then eventually you're going to have an engineer that's going to receive the particular parts when they arrive. And I bring up an ERP integration because it can help simplify the process, but it's not essential in order for Nuvolo and PartSource to work together. So why would you do this? And what are the benefits of this sort of an integration? Well, first and foremost, that automated workflow. The parts order and procurement workflow is based on your organization. We're going to expedite the entire process utilizing what your system defines. In regards to data integrity, your reporting is suddenly enabled. You're not having different manufacturer catalog numbers for the same part, suddenly disrupting your ability to plan. You can gather additional context from these reports. And one of the things that's immensely beneficial of this, it's two-way communication. So we're sending information from the CMMS to PartSource, and they're going to be able to report on certain information as well. And so suddenly, you own your own destiny from the CMMS perspective, but when you need backup regarding you haven't done a great job tracking your DOAs, leave that to PartSource. You're going to inform them, and they're going to keep track of that, and they're also going to be feeding their quality engines. Inventory enablement. Again, now that you've got that standard data and you have the information, you can suddenly start creating real storerooms based on your parts usage. And once you have those established stores, you could even set your replenish thresholds so that you're ordering automatically. And lastly, utilize single source practices when it's appropriate. If you are a PartSource Pro customer, you want to use PartSource as often as possible. Even if you're not, you still likely want to use PartSource fairly frequently because of its ease of use. And you can save time by not going out and doing the research yourself. Leave that to PartSource. So when we demonstrate, we normally like to go through different roles. So today, as I go into our system and we show the integration, realize that I'm speaking to this from the engineer perspective. All right, so I wanted to start out by showing a storeroom. And the reason I'm doing this is because as I place an order for a part, I'm going to have it go not only to the storeroom, but also to a work order. So down here, we've got a door assembly for a Plum 360. I'm going to open this up just so you can see what the count is in this store currently, and we're going to talk through that later on. So right now you can see there is a quantity of 5. So what I'm displaying now is a corrective maintenance work order. I'm going to go through this process twice. Once where I speak to the process and some of the benefits, and then I'll go through it a second time for speed. Because again, this is about engineer enablement, and I want everyone on the call to understand how quick this is. So I know that I've got a broken door assembly that I need to replace. So with that, I'm going to launch PartSource. And this is for a Hospira Plum 360. And again, this should feel familiar. I don't think that this is a new environment for most engineers. I'm going to order 2 of these. Again, one that I'm going to put in inventory and one that I'm going to apply against the work order. If I wanted to double check against my manual, I can do that here. And you can see information is automatically brought over from Nuvolo. And this is the type of information that's going to enable PartSource to be able to provide valuable reports back to you as well. We're now going to look at our cart, proceed to our checkout, and you can even see that additional context right here. I can pick my shipping location if I've got multiple set up within my PartSource account. If I wanted to modify the attention, I can. I'm going to include the PO, and that's going to assist if you have somebody at the dock who needs to receive it against your ERP system. This can assist with that. Once I hit continue, it's going through and calculating the shipping costs. And then here's where I would put in the PO information. This is the easiest way for organizations to utilize this and to really make it just chug along is if you have the capability of utilizing blanket POs. And one of the constraints that organizations have regarding blanket POs is there are concerns about the checks and balances, especially regarding price and receiving quantities. You can get those reports now from Nuvolo, and you can also get those reports from PartSource. So you can use that as a way to convince your finance teams that this is the appropriate route to go. All right, and now I'm going to place my purchase. So my order's been it's been placed. Now all I need to do, I'm going to go ahead and close this out. I'm back at my work order. I'm going to reload my work order. And you'll now see there's an attached requisition down in my related content. I'm going to go into my requisition. Here I've got some header level detail. And then I'll look at the individual line for that part. It's finally arrived up into the shop. And so now I want to say that this has been delivered. I'll update this record. And from the requisition, I now have the ability to receive it. And this is where I really feel the magic happens. This is where a tremendous amount of that value really comes through. As you look at this, I'm receiving against a particular requisition line, and I can have this go to a storeroom. So I'm going to have one go to store, and then I've got another that I'm actually going to apply against the work order I was just in. And now I'm not going to have to go through and put in that itemized cost. It's going to apply it automatically. I hit OK, and I want to validate that that parts cost has been recorded against the work order. I scroll down. Within my itemized cost, you can now see that I have my door assembly coded in. So it was very simple. And again, the idea behind this is it's about enablement. Let's make this as short and sweet as possible so that engineers can get back to their everyday job. This is more or less some of the administrative work that people don't always enjoy doing. So let's expedite the process. I also ordered one that I wanted to go to my inventory store. You can see here, I now have 6 in my inventory store. All right, so now that we've seen it and kind of talked through it, let's go through once for speed. So again, we launch it, we're finding our model number. We're going to go find our part. We want one to come out to inventory. We've got our contextual information that we're passing both ways. We're going to view our cart. We want to check this out. Yeah, this can go to Kyle. I feel comfortable with this. Calculating my shipping. We're going to say I actually need this overnight. All right. Okay, our order's been placed. Now we want to go through and actually receive that against the work order. Okay, and I've got my requested line here. Go ahead and update my record. I'm going to now receive it, one against my store and one against my work order. All right, and I think time-wise, we were right there, probably around 2 minutes and 30 seconds. And so the question is, can you do it that quickly today? Or is this something that you could find value in? And that's what we've tried to address in working with PartSource. We want to provide value. We want this to be easier than it has been in the past. So Nuvolo, we do more than HTM. Our goal is ultimately to create the connected workplace. We want to connect all people, locations, assets, and business services utilizing solutions for these different areas of the business. The wedges exemplify those areas of the business we address, which in turn allows a more collaborative environment in which activities are easily coordinated and tracked, which ultimately leads to an improved employee experience. A portion of this is done by being built on ServiceNow. We're able to leverage the exceptional infrastructure of ServiceNow, which creates an environment that can be more dynamic, easily reported on, and scalable. It's our infrastructure and solutions which truly enable a connected workplace. With that, we can now move on to questions and answers. Dave, is there anything you'd like to add?
That was great. I think it really demonstrates the power of the two platforms. Happy to answer any questions, and happy to talk about PartSource's, roadmap if anyone has questions, or how we want to move forward. That was great, Dustin.
Thank you.
Great. Okay. Yes, we've got a few questions. So the first one is, can I also track similar parts from different vendors or OEMs with the ability to flag one being preferred over another?
So you can do that in either Nuvolo, or you could also set that up within PartSource. And the choice is yours. One of the things I would say, I do think it's important to leverage a lot of the quality work that PartSource has done in the past. And I would almost encourage organizations to lean on PartSource for that information.
Yeah, I would echo that, Dustin. I think there are capabilities in both systems that are worth talking about. Certainly, there are multiple ways you can do it in PartSource, whether it's simply using our buy it again functionality or creating your own preference lists. You can create as many lists as you want of, my favorite Stryker parts, my favorite Siemens parts, my favorite parts for this particular patient monitor, my favorite parts for this particular asset. Whatever you'd like, you can do that within our system as an individual. And then more importantly, at the hospital sort of leadership level, you can create those favorites, create those preferences, and you can hard code those into the procurement practices of your teams, such that you can make your preferences, whether they're economic choices or they're quality choices or they're operational choices, you can make those work across your entire enterprise. I always joke with HTM leaders that there's no way that they can send out a memo, at the beginning of every month saying, guys and gals, remember to buy X or remember to buy Y. And so absolutely, we've built these functionalities to manage those preferences in multiple ways into our platform. Happy to answer additional detailed questions on that as it comes up.
Okay, the next question is, can both hospital providers and healthcare service companies both utilize this Nuvolo plus part source solution?
Yes, we support independent service organizations just as often as we support IDNs, and so the capability is definitely there.
Yeah, nothing to add. I think that sums it up.
Okay, the next question is, our health system has a corporate-wide tool used to also track contracts across the entire business. Could the HTM contract data being brought into Nuvolo to easily be used to show if assets have parts or labor contracts?
Yes, so, and what's nice about it too is oftentimes when you're tracking your contracts as an organization, you're going to have master service agreements. Nuvolo does an excellent job of tracking the coverage down to the asset level. So we can set up a master service agreement within your organization. And even if you have different levels of service, for instance, different parts and labor conditions associated with a contract, you can have that all roll into the same MSA. So it can be done, and it should be done. We've had organizations that have actually identified significant savings by tracking those contracts throughout the life of the contract and understanding the discrepancies and where they were overpaying.
Yeah, I would just pile on to that, Dustin, to say that both the OEM community as well as the hospital community has asked us as well to make sure that we can handle that kind of complexity, that makes sure that you can put both a contract part or a non-contract part, if you will, in that same shopping cart, services as well, making sure that you can check out under the terms of your contract that is managed perhaps in Nuvolo. So that is something that we are actively working on and we'll be releasing shortly, so that those kinds of contracts won't be a barrier anymore. You can actually get whatever you'd like through the PartSource platform. And I would just tag onto that the OEMs themselves see this as a great benefit. It allows for consistency of access to their parts, whether it's an on-demand or a contract relationship that they've got with a particular hospital. And I think from the hospital side, it just makes sense. It furthers the sort of one-stop shop kind of capabilities that PartSource offers today. So I think it's another great marriage, and maybe another great great webinar for us in the future, Dustin.
Yeah, man.
Okay, now will Nuvolo bidirectionally integrate with common procurement systems such as Oracell, Lawson, etc.?
Yes, so we do have integrations. Lawson and PeopleSoft are a couple that come up fairly frequently. If there are APIs, that's the easiest way that we can actually start that discussion. But integrations with ERPs are common. Ultimately, when going through and setting up Nuvolo, it's something that should be discussed immediately, just because the value that you can provide out the gate is going to be increased tremendously by having an integration such as that in place.
Okay, now is there a way to set up for a part to be ordered on a routine basis rather than constantly ordering each time?
Yep, absolutely. And that was one of the things that I had brought up as you go through and you're actually you set up storerooms, you can set up those replenish thresholds so that an order would kick out. At that point in time, the one thing I would say is oftentimes that is going to require some sort of an integration with your ERP in order to get the appropriate financial information sent over. One alternative to that, though, is I would imagine that in working with PartSource, there could be the ability to also manage those replenishment thresholds if you had a blanket PO in place for your organization.
That's right. That's right. We do that all the time.
Okay, another question here is, this is a functionality techs and managers have been requesting for years. How do you make the case to supply chain, finance, or other decision makers to implement? And how can PartSource and Nuvolo help teams make this a case?
Yeah, so that is a phenomenal question. When looking at kind of the new age best in breed CMMSs, one of the things that is going to come up is the price tag. And so the question's ultimately asking, where do you get those benefits that really enable the justification for this? Well, first and foremost, as Dave alluded to early on, one of the biggest issues in the industry right now is lack of data. A lot of the legacy CMMSs out there, unfortunately, you don't have the capabilities to do some of the proactive planning that you can with a new age tool. And so you start to look at it as the dollars spent on the CMMS are oftentimes going to relate to, I don't want to say wasted, but not optimized labor time, for instance. And so by being able to assess a new platform and think through the ways it's going to save your organization time, that's how you're going to justify getting this platform. And thinking to the future, not today. Are you going to get the immediate price tag out of a new system the day you buy it? Of course not. I don't think that's realistic. But as you start thinking through, if you're on Nuvolo and you're utilizing this PartSource integration, engineers can save a tremendous amount of time. How much time is frequently spent trying to search for parts? You may have an engineer who does 2-3 hours worth of research that if you had a sole source agreement in place with PartSource and it is in their catalog, it took me less than 2 minutes and 30 seconds. And it's areas like that that are going to create the value to justify a best in breed CMMS like Nuvolo.
Yeah, I would just add a couple points onto that. First, from the PartSource side, and then how we can work together. From the PartSource side, if you're out there and you're not currently a customer and you want to reach out, we can walk you through how to make the case to your senior leadership in very clear both operational and economic terms. You know, we from a platform, even independently of Nuvolo, but it's enhanced with Nuvolo, see incredible reductions in order time. We see 6x improvement in quality related matters. We see, you know, 7-figure savings routinely across our customer base. And it's all about things that I would, you know, sort of underscore that Dustin already said, which is, you know, speed to quoting, speed to approval, speed to fulfillment, speed to arrival, speed across the platform, whether it's reconciling orders, which takes teams an incredible amount of time today to do across hundreds and hundreds of suppliers, and when you could let PartSource do that for you in a very digitized, time-stamped, repeatable process, you know, or it's sort of the just taking advantage of our quality engine, as Dustin called it, to make sure you're getting parts at a higher quality and reducing return rates, which is has a direct correlation on asset uptime. There are a whole bunch of ways that we can quantify that for you and help you tell that story. That story is made even more powerful when we do it together with partners like Nuvolo, and we have and would jointly visit when when we can travel again, or virtually help you have that conversation with your leadership to show you how the powerful combination of both companies have a multiplying effect on the efficiencies for your team. That's what we do every day, day in and day out. So I welcome anyone to reach out to Dustin or myself with further questions.
And one thing I would add to that is contract savings. If you're not tracking your contracts right now, that's an extremely easy, likely out the gate win, because unfortunately, I don't think it's anybody with bad intent, but oftentimes some of the service providers that you may be working with, they may not be adequately tracking the contracts as well. And so they may not even realize that they're giving you a poor deal. And when that information is passed back to them, it provides real opportunities for you to go back and renegotiate. And that's an instant value add if you move to a platform like Nubolo, because you have that visibility very, very quickly.
Okay, we've got time for one more question. Have you installed this in any VA facilities?
I know that Nubolo is in some VA facilities. I do not know that the PartSource integration has been completely set up. That's something that I would have to look into, but I'd be happy to email a response to that.
Okay,
Yeah, if we can collaborate on that one, I'm not sure either.
Okay, I will get the attendee to reach out to you. Okay, we are coming up to our hour, so I will wrap up now. So thank you, Dustin and Dave, for a great and informative webinar, and thank you again to today's sponsor, Nubolo. Just a quick reminder that the post-webinar survey and certificate process is automated, so the survey link will be included in the follow-up email, which you'll receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately. If you have any questions, please contact us at webinar@mdpublishing.com. And for more information about all our upcoming webinars, please visit our website, webinarwednesday.live. Thank you once again, Dustin and Dave, and thank you to everybody that's joined us today. Enjoy the rest of your day, stay safe, and we hope to see you next time.
Thanks all. Take care.
Thank you.